You are very welcome to this video, and as you see I'm wearing my standard shopping mask. Now I think this is probably quite a good one when I blow. Obviously my glasses steam up, that's a universal problem, but I can't really feel much air coming out of the sides. And I just want to see if it's reasonably good at stopping airflow. So I'm just going to light my candle. And we'll see if I can blow it out. So I'm blowing as hard as I can now through the mask. Let's pop it up a bit. No, can't blow that out. So the mask is working reasonably well, I think, there. Now, I get so many questions. The reason I'm doing this is I get so many questions asking me about oxygen saturations and wearing masks. So I thought I'd try an actual live experiment. So we'll put the oxygen saturation machine on me. Been wearing this mask for about the past hour or so now. But I've been running around doing kind of normal jobs around the house, going up and down stairs and things like that. So what have we got? Well, my heart rate is currently 88, 89, 90, 89, okay, 86. Sometimes settles down a bit over the first minute or so with this on, well, the first 20 seconds or so. That's okay, because I've been running around doing normal jobs, going up and down stairs and things. So the lower figure is my oxygen saturations, and it's varying between 97 and 98. Staying on 97, 98. Okay. So that means my blood is 98% saturated with oxygen. And that is quite acceptable. And this mask is actually quite good. So there we go. Bit of a crude demonstration, but I think it gets the point across that wearing masks does not drop oxygen saturations. Now today, I'm going to have some news from the United States. There's actually a couple of inconsistencies there I want to look at. And I'm kind of aware that yesterday's video on the UK left things hanging a little bit. We were having a debate, if you watched it yesterday, between what Imperial College was pessimistically saying and what King's College and Tim Spector and the COVID Zoe Symptom Tracker app was slightly more optimistically saying. So I think I've got a bit of a resolution to that, and it's related to the Office for National Statistics data, and it is consistent with the King's College Zoe Tim Spector app, just to give you the bottom line. Now, just to start us off today, as we have been doing, let's look at some comparative figures. Because this second wave in Europe really is, it's turning out to be a bit of a tidal wave. I'm not going to use the term tsunami, I don't think it is, but it's significant, it's significant. So here we have the cases in Belgium per capita, then the Czech Republic, then Slovenia, then Switzerland, then France. And we see the per capita cases are really quite high in these countries. Going down we have Spain, the United Kingdom, United States, Germany and Canada. Canada going gradually up, but has been doing very well. Now I wanted to show you that to put some sort of context in. Now there's quite a few things I want to say about the United States, but I'm not going to say them for a few days because I don't want to be accused of any sort of political bias from the United States. But I'm going to give you some straightforward information now from the Centers for Disease Control, and I'll be showing you some useful graphics in a minute as well. Now here we have the this is from the Centers for Disease Control. Now let's get rid of me a minute. Now fortunately, and I've just cut and pasted this directly from the website, seasonal influenza activity in the United States remains low. So many parts of the world, for example Australia, which we often follow, has had the lowest flu season in living memory. I haven't got a figure on it, but lowest flu season for a long, long time. Not a great deal of flu in the United Kingdom yet at the moment, and that's the official data on the United States. Not a lot of influenza around at the moment, which is good. But the Centres for Disease Control has invented a new term, Pneumonia, Influenza, COVID-19, PIC. So pneumonia, influenza, COVID-19 type illness. And they've conflated all these together. Now, this is a little bit confusing and it makes the data somewhat hard to follow, to be quite honest. I can't say I'm overly happy with it, but the point I'm making here is that given that the influenza figures are very low in fact, that means that most of the PIC, new term, most of the PIC that we're seeing is actually not due to influenza, but it's due to COVID-19. And of course we know that COVID-19 is a major cause of pneumonia. And pneumonia is when the air sacs in the lungs fill up with fluid. So yeah, there we go. So we'll need that. We'll need that to understand what we're about to do. Now, positive tests in the United States are high. For every 100 tests that are done, a lot of tests are coming back positive, and this indicates there's a lot of community transmission in the United States. So the community transmission is certainly carrying on apace, no question about that. But as we'll see in a minute, the deaths aren't following suit, which is really good news. I mean, they're still significant, but anyway, let's go through it. So week 42, ending the 17th of October, 6.6% positivity, reasonably high. Last week, for which full data is available, ending 24th of October, 7.1%. So there's no question that this is indicating significant amounts of community transmission. Percentage positivity increased among all age groups. So this is affecting all age groups. And because it's affecting the elderly as well, you would expect the death rates to be rising, but we'll see in a minute that they don't seem to be. So anyway, it's affecting all age groups, and it's affecting all of the United States. Now, there's 10 Departments of Health and Human Services, HHS, regions in the United States, multiple states obviously in one region, and the percentage of positivity is increasing in all of those. So this is all mainland continental United States anyway. Now, how is this feeding through into hospitalisations? And this is a bit strange, actually. This is a bit strange. Let me tell you what I mean. So hospitalisations. Now, I've just lifted this, literally just lifted that, about an hour ago from the Centre for Disease Control site. Since the week ending the 26th of September, weekly hospitalisations have increased. Okay, pretty straightforward statement. Up-to-date information from the Centres of Disease Control website. Hospitalisations have increased since the 26th of September. But then when we go on to the graphic that shows the hospitalisations in the United States, where are we? 26th of September there. And these different lines, of course, are the different ages. These are the older age group, middle age, younger, and much younger age groups. So yes, it's increased. Yes, it's increased. Yes, it's increased. But now there's been quite a dramatic drop-off, decrease there. And that is the week ending the 24th of October. So we see a clear contradiction between this statement and this graphic. No two ways around that. It's not. We've seen a drop off in that last week, for which full data is available. I can't explain that. It's an inconsistency. So when you get conflicts in official data like that, it's a bit annoying, to be quite honest, because we really don't know where we are at. Now, if we go into the United States as a whole here, we do see that the figures are getting on for 9 million deaths, of course, continue to rise. And we see that at the moment there's 2.697% of the United States population currently infected with SARS coronavirus 2, according to this data. And we see this increase here. But when we go on to deaths, the amount of deaths are flat, basically, since September, October. No increase in deaths. Now, given that there's an increase in cases, we would expect there to be an increase in deaths. Now, we know there's a lag effect, but by now we would certainly have expected to see that increase in deaths, and we're not seeing it. So we can only conclude, and this is remarkably good news, that the case fatality rate is going down. Now, the infection fatality rate was presumably the same all throughout the pandemic, but the case fatality rate is going down. So that seems like good news. Anyway, let's carry on with information here. Increased rate amongst adults aged 18 and over in terms of hospitalisations. This is what that data was saying, but not transposing into deaths, fortunately. Now, this has been a constant issue in data from the United States. In terms of deaths and hospitalisations, Hispanics, African American, Black Americans and Native Americans are greatly disproportionately represented. And here we have the latest figures for that. And this really is quite powerful data, to be quite honest. The differences are so stark. It really is quite powerful. Age-adjusted hospitalisations. In other words, they've accounted for the fact that different age groups are being admitted. They've adjusted for age. Hispanics or Latinos, 4.4 times that of non-Hispanic white people. Well over 4 times the hospitalisation rate. Well over 4 times, 4.4 times. It really is quite a powerful statistic. American Indians or Alaskan Natives, 4.3 times non-Hispanic white people. 4.3 times. And non-Hispanic, what's described as non-Hispanic black people, 4.3 times. So we can see all these are similar. All well over 4 times more likely to be hospitalised than white people. And there was a distressing video I saw today about I think it was the Navajo Nation in Arizona, very high death rates. Quite a distressing article to watch, really. And I know, you know from data that we've looked at many times, that although quite a few white people in the United States are low in vitamin D, in black people in the United States, very many more of those are deficient in vitamin D. And we know it's the same in Hispanics. I don't have any data for American Indians or Alaskan Natives, but it would be interesting to find that out. Not saying that's the cause of it, it's just such a simple variable. It would be so nice to eliminate that variable and then revisit this data. Other factors going on, yes. Comorbidities, social factors, behavioural factors. But, to have such a big difference. And the Centers for Disease Control website really don't explain that. They do offer some explanations related to living conditions and socio-economic factors. But there really does need to be an analysis of the vitamin D levels there. It's just such an obvious thing to do, and it hasn't been done. And I'm fed up of talking about this, to be quite honest. I've been talking about this since February, and it's still not being done. Same in the UK. Deaths. The percentage of deaths from pneumonia, influenza and COVID deaths flat from mid-September through to mid-October. So they are not increasing. Let's just look at that again, and we see that that is the case from this data. So that's good. That's very good. Death certificate data. The percentage of deaths attributed to PIC, pneumonia, influenza, COVID for week 43 was 8.2% of the total deaths. Now, given there's essentially no influenza now, I think we have to assume that this 8.2% of deaths is mostly attributable to COVID-19. But there again, of course, this time of year, getting people in, we call it an acute exacerbation of chronic obstructive pulmonary disease. We get huge amounts of patients in this time, well, not so much this time of year, but yeah, starting this time of year and going on through winter, where patients with chronic obstructive pulmonary disease, mostly because they can't clear the mucus, the bacteria settle in the mucus and they get bacterial secondary infection. That goes down to the alveoli and causes pneumonia. So that's not at all uncommon. But I think we can say that that's caused, so that 8.2% in other words is caused by a combination of exacerbation of chronic lung disease and COVID-19. And that's the way I would interpret this data, but we don't have enough information to differentiate between the two here, which is a pity. It's declining, this death percentage is declining, but it is still above the epidemic threshold, so it's still classified as an epidemic. Right, so that's what I wanted to say about the United States. I think I'll just mention I'll mention Poland. I might do the UK as a separate video because what I want to say about the UK today is quite complicated. Poland basically seems to be shifting to a strategy of guarding. It's got greatly increased cases for its population, and the Prime Minister is saying people over 70 should stay at home for the next 2 weeks, so seem to be going on to a kind of guarding type strategy. And there is validity in this because we've seen that the community transmission in the United States is high, as indeed it is in the UK and all over Europe. But things are going to get better in spring when the vaccines come, is still my belief. And if it's a matter of staying in over this winter to have many more winters after that, it's probably worth doing. What I would say is, you know, people round about you are frightened and they are guarding. And social isolation can cause mental illness, distress, even suicide. So just look around, and if someone is socially isolated, un-isolate them. You know, that's my job and your job. So who lives next door? Who lives across the road? Who lives 2-3 doors down? What local group is there? What church group? What synagogue group? What mosque group is there? Or whatever it is. And what community health group? What volunteer group is there? What food bank group is there? And just go to people. You can talk to them through the window. You can call them up. You can Skype them or FaceTime them or whatever you do these days, and just take away their sense of isolation. You know, if you're cooking a meal, cook a bit extra. Cook an extra portion. You know. I mean, you know, someone bringing you food round when you're not well is a pretty wonderful thing. You know, it's you know, help people around you, and if you yourself are isolated, let people know that you're finding it difficult, and say, look, I'm finding the isolation difficult. Can you do something? You know, can I talk to you? You know, let your needs be known. There is no weakness in admitting your humanity. So I think I'll leave that video there for now. And I'm going to say one more thing. Actually, I went shopping today. This applies wherever you are, I think. So I had to go to the supermarket just for some essentials, and nice lady at the door cleaned the trolley for me, gave me the trolley. Mask wearing was 100% in that shop. Medium-sized supermarket, every single person was wearing a mask. Social distancing was respected. People were behaving themselves at the checkouts and were leaving plenty of space. Everything was really good, but the place was stuffy. I was standing in the checkout and I could feel myself sort of starting to sweat a bit. It was a stuffy, humid environment. And if it's a stuffy, humid environment, that means the virus particles are hanging in the air there. So doing everything right, but the doors were closed. People just are not getting the ventilation message. The probability of getting infection is dependent on the viral load. So get the viral load down, open the front door, open the back door, have a through draft. Everywhere I've been, it's not happening. Okay, it's going to be a bit colder. Okay, it's going to be a bit colder. So what? But the ventilation message is just not getting through. Anyway, remember, wearing masks doesn't drop your oxygen saturations. Wearing masks is critical, not... What's the word I'm looking for? Critical, not political. That was the word. In this country, in the UK, it's not really a problem. We have Trotskyists, Marxists, neo-fascists, even Liberal Democrats. Everyone wears masks in this country. It's not a political issue. So remember, masks are critical, not political. Okay, I'll put that up as it is. Sorry, I was prattling on a bit at the end there. If you've watched all that, thank you for watching. And the next one I'm going to do on the UK there's some interesting data coming out, and it's there's different views. It's a bit complicated. I'll leave it at that. But do tune in if you like to watch that. Thanks for watching this one.